All right, looks like we are live. Let's see if we've got everybody streaming in here. Yep. All right. Let's give everybody a minute to get settled. Hey, everybody on this, we're so happy to have you. I posted in the chat discussion. That's where you're going to put your questions for our three phenomenally innovative and intelligent panelists we have here today. So feel free to go to the chat and post them in there. I like to crank things up. And we're going to have fun. We're going to give away Amazon gift cards. This will date this get together here, but it is December 9th, 2020. And Fauci says the vaccines are going to be administered in weeks. I believe this guy. I believe him. So I don't care if it dates this webinar, but that's where we're at. And we need some positivity to spread. So we're going to be giving out a bunch of money, a lot of Amazon gift cards to all you fine healthcare marketers online. Another fun thing I like to do, we're going to have polls going throughout this to get a gauge on what all of you great people out there are planning on investing in terms of digital marketing. And we're going to ask about patient volumes and how you're faring right now. I asked these questions a few months ago and I got interesting responses, so I'm going to keep that going and learn more from all of you. So once again, chat, feel free to put your comments, questions in there. I will check them periodically. If I find one of them to be interesting or relevant to the topic we're talking about, I'll go ahead and propose it right in the middle of things. All right, so it looks like we've got majority of people in here. Let me check a few things. Okay, all right, guys. All right, let's get cracking. So, three phenomenal panelists, could not be more excited. We've got a mix of hospital experience, specialty clinic, dental, urgent, everything you guys could imagine. So regardless of what healthcare organization you're in or subspecialty or health system, small or big, we've got you covered here. Between Kelly, Amanda, and Blair, they've worked in just about everything. They've also been to the dark side and worked at an agency. That's why I'm aging so fast and they're not. So we're going to have a good time. In typical COVID fashion, Matt Gove, who I know some of you were excited to see, he had something come up really last minute, and Kelly has stepped in to help us out. She has run the marketing for one of the largest not-for-profit, if not, they are the largest, Parkview Health, largest not-for-profit in Indiana, and now runs the marketing and biz dev for my favorite hospital in Indiana. So we'll talk more about that later. All right, quick about Cardinal before we get to our panelists, which I know you all would prefer to hear from. So I actually started the agency 12 years ago, so you can say it's all my fault. Ever since we started, we had focused on healthcare. We brought on a primary care with just one location, still a client to this day, 12 years later. So I'm really passionate about helping patients find the right providers, not the right now providers. And so we only work with the best groups in the country. Excited to be doing so. This picture was taken pre-COVID. We're actually double this size, and it was only taken 9 months ago. So crappy year for the world. Digital marketing agencies, I think, have done okay. And the thing I'm most proud of is we won the best places to work this year through a pandemic. We didn't lay off, furlough, or reduce pay for a single person in this company. Instead, went on the offensive and doubled the team. So proud of that, and proud of the clients that we have on our roster. Everything from a 2 location to 2,000 locations, smallest to biggest healthcare groups in the country. And that one in the middle, what's that, Cameron? Oh my God, Kelly, yes, very proud. And Dental One Partners, okay, Amanda. So that's us in a nutshell. Let's get to it. Kelly, tell them a little bit about yourself.
Well, I'm Kelly Hammons, and I work at Cameron Memorial Community Hospital. I've been here for about 2 years, previously at the Parkview Health System. The unique thing about Cameron, we are a critical access hospital that serves a small community in Northeast Indiana.
I love it. And expanding digital, a big thing this year, going on the offensive. Something very interesting about Kelly, guys. What do you have in your repository over there, Kelly?
The vaccines.
Yeah,
we're going to be administering, if all goes well, our first vaccine on Friday the 18th. And we will be offering that to the entire northeast portion of Indiana. So we're really excited about that.
All right. I love it. So we will get no politics on this one, whether you want it. Hey, if you want the vaccine, Kelly's got it. Kelly's got it. So cool. In the same calendar year, the medical marketing marvel that this is, same calendar year, we found the disease and are inoculating people against it. Absolutely amazing, guys. It took 10 years for polio and still have problems with that when I released. So very cool. And it's a cool year to be in healthcare, to have seen it all go down. Couldn't be more proud. Couldn't be more proud of our medical technologists. Amanda, what's going on from City Vet?
Hello. Yeah. So I have been in healthcare for some time. I'm actually now in the veterinarian space, which is very interesting. The patients are a lot cuter because there's dogs and cats and guinea pigs and things like that. But I was in the dental space prior to this, working with you guys at Dental One. And before that, I was at Tenet Healthcare, which is, I think, the third largest healthcare provider in the country, and ran their marketing strategy. So, and before that, I was at an agency. So I've done a little bit of it all. But it's interesting how no matter what type of industry you're in or what your vertical is, that putting your patients at the center of what you do kind of goes across all platforms, and I think that's what makes us good marketers when we do that.
Yeah, and we all had to be put on the spot this year of communicating the ways that patients could access care and changing and getting out in the brand and making sure all of that happened. Crazy year. Hey, real quick, what do you like better, agency or client side?
Oh, they both have their great things. I think I don't know. I don't know if I'll ever go back to an agency. You guys work so hard.
We do.
It's always right. Easy decision.
So I'm tired all the time. All right. Thanks, Amanda. Happy to have you on. Mr. Blair from Carolina. He's a Panthers fan. Don't hold it against him, guys.
Yeah. Hey, guys. It's my name is Blair Primis. I work for a company called Ortho Carolina. It's based in Charlotte, North Carolina, and we're a multi-specialty orthopedics practice. We're probably, as a private practice, we're probably in the top, 4 or 5 in the United States in terms of size. We have 45 office locations, 165 surgeons, and about 1,800 full-time employees. So for specializing in just, muscles, bones, and joints, we're I like to wear a large doctor's office, to say the least. Been here, what I've been here, almost 11 years or so. And in that time, we've more than doubled our size. I mean, we're benefited by this area of the country. Has seen a lot of growth. And so it's been fascinating as a marketer, not just in healthcare, but marketing in general, to see how you can maximize and, do your best to try to attain as much of that patient volume when people move into a town when your brand really doesn't matter because they're brand new. So it's been fascinating for us to do some of that. I consider myself a Panthers fan. I'll pull for the home team. I'm actually from New Jersey originally, so I have some allegiances up there. But for the most part, I'll be a Panthers fan.
Yeah, neither way you go, is there much to root for?
Yeah, there's really nothing to root for. I know.
Doesn't make a big difference. Hey, I'm a Falcons fan, so it doesn't.
Right.
All right, we're not ruined here either. So welcome. That's crazy growth, Blair, and everybody's going to be looking forward to hearing how you guys did it and how you pivoted this year in something in an industry very much driven by injuries, where people aren't playing sports. So we're going to talk about how you guys have pivoted. All right, guys. God, this was only taken 2 years ago, and I look so different. This is the agency that let's get out of here. We're stopping this presentation. Y'all don't want to know about me anyways. All right, guys, we're going to hit the polls. Okay. I know y'all are tired of the polls this year. We're going to hit the polls. All right. So I'm going to start a poll. I want to know the top channel you guys are investing in 2021. We'll see if that aligns with our panelists. I'm going to leave it open for a while. And we're just going to get started with the Q&A. All right. Kelly. So when the pandemic arrived, we had Cameron quickly pivoting, changed the urgent care to respiratory clinic to serve the community. How is the public's response? Did it help strengthen Cameron's positioning? I know you guys were trying to make sure that everybody understood in Angola that you guys are a one-stop shop. How did all these pivots pan out? Have you felt like it's helped your positioning and reputation long-term, or some of these pivots we were doing were kind of Band-Aids, if you will?
Sure. So, I mean, operationally, it's really kind of indescribable the amount of work and dedication that my coworkers have put into, in particular, our respiratory clinic and our response to COVID. I would kind of consider it a little bit of a blessing in the middle of this curse, because as detrimental as it's been, it was really a great reminder to our community in particular, of the work that we do daily. Nurses and physicians are heroic, regardless of the pandemic or not. And we've had a significant outpouring of support, which has been just a really nice reminder, I think, all around. The clinic that you mentioned, we opened that up in the course of less than a week. So it was an all hands on deck effort. Through that clinic, we've been able to service 36,000 patients. I'm sorry, 3,600 patients. But many of those, what's interesting is many of those, it was their first exposure to our system. So you've got people that were otherwise not accessing care at Cameron, interacting with us for the first time. We even had lots of people that were kind of bleeding over the Michigan borders based on our well-managed response. So I would say all the stakeholders in our community were really kind of forced to recognize how important it is to have local care and have a rural hospital in times of need such as this. I don't know how familiar everyone is, but last year in Indiana, we were really kind of at the forefront of a national conversation about high cost healthcare. The rhetoric was, largely about greed and overpaid physicians. And that's long since dissipated, which has been just kind of a silver lining through this pandemic.
Good. And now we value our physicians. Maybe the tagline on Cameron's website is actually going to be so good you'd come from Michigan.
Yeah. Or I'm a Hoosier, so I'm going to say, I guess we'll take care of you, Michigan.
Yeah. A pity.
So some of these things that you put in place really helped. I mean, they were the gateway to Cameron, and got a lot of people familiar with you guys and helping at a time of need. I guess that's why all the health systems are going and gobbling up all the urgent cares. It's really the way in. And so you guys took advantage of that. Really smart pivot, and kudos to your team for moving so quickly. Amanda, so this was crazy. You come from Tenet and Dental One, best dental group in the country, obviously. And then you started CityVet in June of this year.
Yeah.
Crazy good timing on that one. So tell us about that. So you come from very advanced marketing companies. Where was CityVet in their experience and their marketing expertise? Where's CityVet, and what were some of the first things you kind of took upon yourself in the first 90 days there?
Yeah. So we have had the benefit of really growing by word of mouth and reputation and the brand here in DFW. So we've got 17 clinics in the DFW area, and the growth has really been organic up until this point, which is great. But from a marketing standpoint, my job was to come in and really take us to the next level and work on client acquisition and growth in that aspect. So one of the most important things I think you can do is show your value as a marketer. And so I started building a marketing dashboard, setting our KPIs for our campaigns, which I think are really important. And then also, really starting to look at holes of, what are we doing that our clients don't know that we're doing, that they should know. So I think it's a little further beyond just building a dashboard, but really kind of looking at our overall client experience, because I also started, like you said, during the middle of a pandemic. And so it was really taking a look at that experience. Like, do we need to be doing telemedicine? How can we, reach our clients with the technology that they're looking for and the experience that they want? So that was another, important part. And then I think really kind of building the relationship with operations, because I think when you're really trying to grow, it's looking across all the data that you have and saying, okay, we have a new campaign, we're going to start running this. What is the appointment lag time? Can we get clients in, right? Because if you don't have your doctors for COVID or whatever reason it is, and you're trying to drive volume, but you don't have access, then you've got waste and your conversions aren't where they should be. So, there's been a lot to do, but I think, we had great data here and a great team. And so it was really just trying to figure out how we could visualize that data. I use Google Data Studio to show that. I think there's a lot of technology out there that marketers can use to pull in, their data from Google Analytics and their campaigns, and then also pull in those data points that are internal, like Dr. A, a new client volume. So you're really meshing those up and looking at them forward.
Yeah. And so you came in and you saw, hey, listen, it's not just good enough to drive conversions and know how many, but we also have to align that with whether there's enough provider access and do we have the time and all of that stuff. That's something as marketers we don't think about a lot. It's just drive more leads. But is there the capacity and supply on the receiving end? And so you've aligned those. You've got everything piping into a dashboard. I'm sure the providers are excited to see this, that we're matching supply with demand. So awesome. To come in there and start putting the data together. That's the first thing I would also recommend to a lot of groups out there. It's like, don't start flying blind and doing marketing campaigns if you don't know what the hell they're yielding. All right, very cool. Mr. Blair. Oh, I've got exciting stuff on these polls. Okay, we'll release that in just a moment. This was interesting. We wrote an article recently on the backlog. I was reading all about this surgical backlog that we have, and we created this giant ebook on it. Very interesting to see that people were delaying, even though elective care was only shut down for X amount, people delayed going and getting their ACL repaired, et cetera. Have you guys experienced a lot of this backlog, or what are we doing to catch people up or keep patients happy while they wait?
Yeah, so absolutely. So we've experienced a lot of the same things. So it's been fascinating. So you've seen a little bit of a bump, right? We were shut down for about 50 days, health department shut down by 50 or so days. So you had some folks that were urgent or had some sort of acute thing. If you can't walk from your bed to the bathroom, you still need to come in for your care because, you just simply can't get there. But, a lot of the shoulder injuries that would be elective or, wrist pain or, knee pain that hurts when you jog but doesn't prevent you from jogging, a lot of those would have been delayed. So what's interesting about that is we, most overused word maybe in 2020 is we pivoted our marketing to actually create a how to work out and be healthy at home. And we spent a whole lot of time talking to our physicians and our physical therapy guys physical therapy team about having content that's there that makes them, in a weird way, continue to work out so they can maintain the type of lifestyle they had before. Yeah. And so we saw like a big decline in those patients. And then almost immediately when we were able to bring patients back, it was like a hockey stick almost, straight back up. And now to some degree, Alex, it's leveled out to some degree. And that's what we're working on now is how do you continue to talk about, being active in the marketplace, being, exercising on our greenways, continuing to ride bikes. How can you stay healthy at home? What are some things you could do in small groups, or separated by them? Yeah. How do you challenge yourself to run a virtual 5K once a month? So we've been very active in trying to create local partnerships and or content that still encourages physical activity, still is pretty, keeping our finger on the pulse in terms of what we can do with social distancing and things of that nature, and attaching our brand to it. And so I would say, we're doing well, but I wouldn't say that we're actually doing spectacular when it comes to matching previous patient volume. I think I would sum it up to say that overall as a practice, we're at about 90% of what our volume would have been, knowing 90% because of social distancing is now 100. We can't ever get to 100 because we've got to maintain that space. We have screeners. We've got, to only so many, patients in the lobby, only so many employees in the hallway.
Sure.
So at the end of the day, I think it's turned out well for us, but it's not been without its challenges.
Yeah. And it's a good thing. I remember last time we spoke was about a year ago. You had put a whole online scheduling system in a and like a lot of these things, you got ahead of the times. I'm sure telehealth was happening for you guys at that time. You got ahead of it. Something, Blair, I want to talk about later, not quite yet, is the integration with the EMR that you have with scheduling, the track back. We'll get the technologies at the end. I want to make sure stick around as I found that fascinating. And now you've had another year of data on it. So that'll be cool to get updated. Guys, on the polls, I don't think you guys can see the results, so I'll read them out. In 2021, what's the top channel you're investing in? Number one, 36% of the vote, pay-per-click. Rich will be excited to hear that, my SVP of media. SEO, I love it, 31%. Paid social, 21%. Email, 0. Really, guys? TV and radio, 5. Okay. Traditional marketers. Direct mail, 5%. Direct mail works. I mean, it doesn't benefit me to say that, but direct mail definitely works. All right, PPC, then SEO, then paid social. I got a lot of digital marketing on here, I think.
Yeah.
See, we have an interesting question here. Okay. Betsy's asking, can you provide a tip when 2 of your surgeons contract COVID and you must clear the clinic days and or 2 or days? Well, how do you surgeons contract COVID and you must clear a clinic? How do you do damage control? What do you do when you got to quickly pivot? Blair, Kelly, any experience on that one?
So yeah, I'd be curious to hear what you do as well, Kelly. But we're not immune to this. We've had providers contract COVID, I think, like many practices and hospitals. And so a couple of things. One is we immediately contact any patients or any staff, and we do all of our contact tracing as quick as we can, and we contact them ASAP. And then we will do our best. And again, this is maybe a benefit of size, so it may not apply to everybody else, but we can actually rotate physicians and or physician assistants from other locations into those offices to backfill those patient logs. But if the question is really more around PR damage control, I think the answer is transparency. Hiding is not the way to go. The answer would be, listen, we've had a provider, and there's still privacy rules, so we have to maintain privacy, but we've had a provider test positive. They are quarantining now for the required amount of time. We've done some contact tracing. We've cleaned, we've sanitized. We continue to take temperatures. We continue to ask pre-screening questions. We call you beforehand, your appointment as well. We even will sometimes text you and tell you to stay in the parking lot if the office is over capacity. So a couple of things that we put in place. So we just try to reinforce all that we're doing to prevent you and or anyone else from getting it, and that we stay transparent with it. I think in the beginning, people were maybe a bit hesitant because everything was so new. And this happened to us also. We had a TV van roll up to one of our offices, like, rumor has it one of your docs has it. Well, looking back on that now, I'm like, who hasn't had it? I mean, I sound terrible, but it's so everywhere now. Now it's not a big deal that a doctor has it or a nurse has it. So just come out with it, say that it happened, and be upfront with it.
Yeah, exactly. No shame in it anymore. I think we've all adjusted. I'm sure Ravens fans weren't happy with Lamar Jackson, but hey, this is what happens.
This is what happens. Yeah.
My next question, guys, is going to be, thank you for that question. Betsy Golan, we're going to get you out an Amazon gift card, $25. Kat, let's make that happen. Thank you. Hey, guys, I got my next poll, and everybody's already answering. What are your current patient volumes? Okay, I wanted y'all to go answer that before I had the panelists, because if you hear them all say that we're higher than ever and you're not going to answer. So let's go over there. Amanda, how are things going to City Vet? Largely impacted, unimpacted, or we're doing like parking lot calls. I just had to do that.
We are. So it's very interesting, right? Because our patients, we don't necessarily worry about catching COVID from them, right? Yeah. So when it first hit, we split into AB teams to make sure that we were minimizing the risk among our teams. And then our patients or our parents, right, were in the parking lot dropping off their pets, and we had people going in and picking them up. And so really it was about figuring out a way that made sense for us and helped our teams to feel safe while we were still able to see clients. Now we did have a dip, but then we've been able to kind of come back from that. But I definitely think it's about communication with the clients. I think with any of us, that's kind of been the biggest hurdle is, you kind of feel like you're over communicating sometimes about what's going on, but your clients still don't understand how to do the drop off or the pickup or the waiting in the parking lot until it's their turn and wearing their mask and doing all of those things. And so I think that's kind of been, I think it's across the board, right? Is making sure that you're making your clients feel good, but also that your team feels like they're being supported so they're being safe.
Yeah, and being looked after. It's going to be interesting when this is over and patients can come back in there. Are they even going to they're going to go, no, I want to go back to my car.
Well, it's very interesting. So like we have some of our lobbies are open, and we do give our clients the option if they want to do curbside pickup, they can do that. Or if they want to come in and talk to their doctor about, what's going on, they can do that too. And And it's really just about giving them the option and meeting them where they are with, with what they need to make them feel safe.
I love it. I love it. Kelly, how are we doing? Well, now that you have the best agency in the country, I know how things are going now. Talk about the variety through this year. How are patient volume? Were we dramatically affected negatively in March and April, May? Have we rebounded? Where are we slow? Where are we doing well? And which specialty groups?
Right. So interestingly for us, I mean, as a critical access hospital, we're not for profit. We don't experience these large margins. So canceling elective surgeries and closing down our clinics for a solid 5 weeks was, detrimental. I mean, we were really terrified to see if anyone was ever going to be able to have the confidence to walk back through the doors, not only in our facility, but really just kind of across the board. I know a lot of our peers were experiencing the same fears. What's been really nice is that we have really seen most of our volumes rebound. Obviously, our inpatient numbers are higher than they've ever been, simply from a capacity perspective. We're holding a lot more patients that we would have normally triaged and transferred. On the clinic side, we're largely back up to pre-COVID volumes, some even exceeding pre-COVID volumes. Where we're really seeing significant gaps is really just the patient motivators as it relates to just kind of annual checkups, wellness visits, and things like that have been, kind of pushed to the side in a lot of cases. And we have had a little bit of difficulty convincing patients that it is now okay and safe for them to return. Yeah. So in order to combat that, we've just really started offering a lot more options as it relates to telehealth for patients. So we tell them, we're safe to come see when you're ready. And if you're not, we do have virtual options for you. So either way, we just are encouraging the community to ensure that they're still seeking care. But So far, so good. We're in our, we're approaching, I don't know if it's the same around the country, but we are approaching the largest surge that we've had since the inception of the pandemic. And so what that looks like at the end of this, is to be seen.
Yeah. Yeah, we don't know yet. Yeah, that's interesting. I'm glad to hear things are rebounding. It sounds like it's what they said, right? A long winter. I think the next 90 days is going to be tough on patient volumes and everything else. But glad to hear. I mean, that was a scary March and April, and you guys have rebounded in a lot of ways, in a lot of good ways. Blair, last time, so 100% growth over the last 10 years, we're driven largely by sports injuries. How have we made up for or fared, or are any certain lines? I know you guys have the urgent care for ortho to get the sports injuries back. How are we doing?
Yeah, so we're doing well. I mean, we've had isolated weeks, believe it or not, like Kelly was saying, that actually outperformed pre-COVID weeks. But in general, we're still off a little bit from every month is a little bit off from that month the previous calendar year. Yeah. Having said that, March and April, March was bad. April was really bad. I mean, anecdotally, the worst month in the history of our organization in April. Yeah. Having said that, June is a little bit better than May, July a little better than June, and so forth. And as you sit here today, we're getting pretty close to getting back to the levels we were at pre-COVID, 2, 3, 4% some weeks, 1% one week, subtle little differences. I think what's helped us get back there is and it's funny, I think, Amanda was touching on this, be careful what you market if you don't have physicians available, because then the thing you're marketing is really crappy. Come get the new iPhone. Only kidding. It's not available for another month. Well, same thing in medicine, right? Come be seen. Well, guess what? It's a 35-day wait to see that doctor. Why the hell are you marketing to come see him? Mm-hmm. And so I think what we've been benefited by is we've had availability because the scale of our organization and the number of providers, 300 some odd providers, provides openings now at a degree to which we've actually never really had before. And so even though we are seeing potentially lower overall new patient volume, total volume is actually pretty close because the time to be seen has shrunk because the number of providers that are available to see patients is the same. So if the volume is down, but the wait times are less, we can actually see more patients. And so it's through physician assistants, it's through, newer physicians. I mean, we this August still added, 11 new physicians leaving fellowship. And so I continue to to build that out. So we've expanded our urgent cares during this time. We actually went to daytime hours at 2 of our locations, fully walk-in. And, we'll talk a little bit about online scheduling, but we started that about a year ago, and we're now in full tilt with online scheduling. So we now have book online for every single location, every single physician, and every single physician assistant. And so you don't ever really need to call, or candidly, you don't even really need to come to our website. If you go to the Google page associated with that group and hit schedule now, you'll just be able to book directly into our system. So I think all of those help us get back to where we are. I mean, a positive number would be rock star, but flat would be almost as exciting.
Yeah, and the good news is no other ortho group's doing better. Everybody. So you're not going to lose your surgeons to other groups because the whole thing is hurt, right? So if there's a silver lining, and it has forced us to all adapt so quickly. Now we've learned more about the urgent care and expanded that, and a lot of things. These things will stick next year. Another little silver lining I'm hearing from all of you is because there's kind of less volume, the patients are getting more attention and more care from the providers when they're being seen. That's not a terrible thing for a year for people to get a little bit more attention. I'm used to seeing the mid-levels and stuff, which is great. But current patient volume seems like stagnant, down a little bit, up a little bit. And that's symbolic of what I'm seeing here in the numbers. Lower than typical volumes, 53% of you guys said you're lower than typical. About the same, 23. Higher, about the same. So higher and about the same. 46 or so percent lower, we're down, it's 53. I asked this question 5 months ago, 90% were dramatically down. So things are getting better. Okay.
Oh, wow. Good.
One way to look at it, I guess. So we've got some really good questions here. I'll send one in here. I don't know if people just want Amazon gift cards or there. But anyways, these questions nonetheless. All right, here we go. From Rachel Saucerman, have you all developed any long-term tracking strategies that help you measure the value of content marketing, knowing that those patients don't necessarily schedule right away, but it may influence their choice later? Is there any tracking solution to know the downstream effect, if you will? How do we know, or what do you guys look at?
Yeah, so any sort of robust attribution, I assume, is what the question is asking about. Yeah. I mean, absolutely. And so there's I think a couple of mechanisms I might suggest you consider. One would be to see if they can subscribe to your newsletter. It was interesting to have them doing email marketing because I am super bullish on email marketing. So for what it's worth, I'm a big email marketer. But one of the things we will do is a lot of our long form pieces, we call them explainer content. If we go deep on, and bear with me, like cartilage or, spinal stenosis, and if we get a decent amount of engagement on it, we ask folks if they would like to subscribe to our newsletter for more of this type of content. And, even though, it's 7 to 9 to 11% take rate, that's a measure to me that piece of content is going to be continually effective for that patient. And the odds are they are suffering from that condition, or there's something curious about it that they're asking for more content. So if you have a way to either capture either a short form, do you want more info? Do you want us to send us a video? Put some way on your content to capture if they're interested for more of it. And my gut tells me that's a really great way to show some kind of attribution. The second thing we have, and I'll go back to it, is the ability to schedule online. So we actually have a make your appointment button now on every piece of content that we have. And while it's not a huge, click through, we do see some folks that will ingest this content and then decide to book directly from an article, which to me is just indication that, if you take the sum of its parts, and if that rate is 3 to 5%, but you need the 5% to 100%, find which pieces of those content get you close to the 100, and then add more of that content to your site with those links, and hopefully you'll find more attribution to it. Those would be a couple I might just mention.
I would also say that it also depends on what industry you're in. If it's relative to the decision-making time. So I feel like in orthopedics, you've got a little longer decision-making time as well as you're in dental. It's need a dentist, find a dentist. Typically, it's urgent care type of medicine. So, it also really depends on your industry as to how long it is from the first touch point to when they make that decision to book. So I do think if you have that longer term, like you're in, this long format content where they're getting educated, deciding what type of surgery they want to do. There's lots of options, right? Like if you're in dental, a root canal is a root canal. So it's like, where am I going to go to get that done? And how much pain am I in right now? And how quickly do I need to do that?
Yeah, it's a great point. Where are they in the funnel? If you can't go from from your bed to the bathroom because you can't get out of it, you need to be seen now. But if you've been lingering with a shoulder pain, some sort of minor tear for months or years, I don't know why you would all of a sudden decide to go during COVID. You'd be like, what, I'll just wait. I'll continue to wait. So you're right. You're absolutely right. There's definitely a longer lead time for where those folks are in that funnel.
And in dental, the more immediate need type services, dental and urgent care being the two I'm most familiar with. Email maybe not in the nurture, not as necessary on the front end, but Amanda, is it necessary for reactivations? Should these more quick hit type specialties, should they be using email a good bit for reactivation and getting people back in?
Yeah. So I love email for pulling client lists with open treatment plans and having them in a nurture campaign to reactivate them. So we would set up campaigns that were automatic, that at the end of every month, if you had an open treatment plan meeting, we recommended a treatment for you and you decided not to do that day, or you didn't book your appointment, you would start into an email campaign to bring you back in. So hopefully you would schedule.
I love it. Let's just talk marketing. I got another question. We might get to it. Let's keep going in that vein. What platform? So what are we using? Or have you guys personally built out all of these automation? Are you using something sophisticated like a Marketo or Pardot or Constant Contact and MailChimp without sophisticated automation sequences? Hey, if they're a client, they go here. If not, they go there. How are you guys segmenting, or how detailed are you getting on your email?
Go ahead.
I was going to say, well, I hopefully soon will be at CityVet, the new platform, to make sure that we are automated. We reach out pretty manually right now with our client lists. But in the past, yes, I've used a lot of different platforms like Marketo. We had one that was specific to the dental space where it did reminders and confirmations. And then we were also able to pull lists on open treatment plans, like I was discussing. That was really specific to the dental space. There's lots of great ones like HubSpot, and things like that. I do think it's worth the investment, because when you can reactivate a client, it's a lot easier to get a warm lead than a cold lead. Right?
Yeah, and it's a lot cheaper to have them come back in, right? Mm-hmm. Rachel, thanks for that. We're going to send you on Amazon. Everybody loved Rachel's question. Everybody loved it. Okay, Nancy was thinking the same thing. I like that. Hey, you guys are talking about lead nurture. Kelly, are we handling most leads through lead form? What do we do with the initial follow-up? Is it an actual person doing the personal follow-up, or do we have automated lead nurture workflows to get people in, or how do you guys handle that at Cameron? Is it personal or is it automated?
So dependent on the clinic, on the outpatient side, so in any of our practices, it would be personal. And then for the hospital side, you're going to see more of the automated.
Our brand awareness and education of the market this year. What were the main tactics you switched to this year? And then we're going to talk about what you guys see in the next year. But what were the main pivots, marketing tactically wise, this year that you started with? Blair, we'll kick off things with you.
Yeah, so it's not really that sexy, but we found tremendous results with it, and we started producing more video, and we kind of really took the time to put out an RFP for sort of almost more of like a cinematographer, if you will, like legit filmmaking kind of stuff, and we created a 6-part episodic series that just ended actually last week. That we called the Orthopedic Anatomy series, where we put out 6 90-minute essentially episodes all around different parts of the body that featured physicians. We did deep dives, we did case studies, we used cadavers and different parts of all different parts of the body. And we did one for each main section, and actually are in the process now of creating like a, if you will, almost like a Netflix style page where you can choose which episode you'd like and stuff on our website. But the idea would be to create, how do we create, to your point exactly, you don't know when somebody's going to be in the orthopedic funnel need for orthopedic treatment. And so the idea would be, how do we create long-lasting, it's broken out to smaller segments based on either case study or spotlights. We may do a case study on hand anatomy. We may do a spotlight on carpal tunnel or what is trigger finger, something like that. And so video, we took a lot of time to dive into video, and then we spent almost an equal amount of time figuring out how to distribute it, right? Because the greatest content in the world is...
How'd you get it out? I wish we could all afford videographers, but
right.
That's a nice thing to have. So, but how'd you guys distribute it? Did it just get launched on the website and then we transcribed, or in hope that Google picks up, or Facebook?
Three main approaches there. One is and again, I'll go back to email. We have been very diligent in collecting emails for patients. So our database is pretty massive, a couple 100,000 patients deep of a database. And so we distribute all the content via email. We obviously use some of the normal things, social and that, but we actually put paid dollars against it on YouTube and Facebook. And then lastly, we do a weekly partner newsletter where all of the marketing or media partners we have, about 85 or 90 of them, every week we send them a newsletter telling them what we're going to talk about that week. And so that way they know, as their partner, what it is we're going to be focusing on, and we ask them to do that. So when our episodes come out, old-fashioned, I'm an agency term here, we roadblocked all of our content when these episodes come out. So we ask our partners to also share the episodes being released at the same time we're doing email, same time we're doing digital. And so far we've been pretty successful. It's in the, eclipsing 20 some odd thousand views for the whole series. So we're feeling really good about it.
Yeah, that's good. It'll be there forever. It's not even a COVID thing. That's useful forever. When I tore my ACL, I read and watched everything. So hold on one second. Guys, the webinar platform's having some trouble. If you're getting choppy or frozen, just press the green reconnect button at the top of the screen to refresh. Anybody that's listening. Amanda, this year, what did we need to make some marketing pivots? One thing working better than the other? Anything changed with how the consumer wanted content? Tell us about it.
Yeah, well, I think that video is something that I would talk about as well. We have the approach of a little more of snackable content that is feels a little more user generated, right? So I think that you can make really great content and video, and it doesn't have to be overproduced. Because that's what people are looking at on their phones as they're scrolling, right? And so when it feels organic, people also are really more likely to watch. So we will be getting into video. I will say, I've been doing a lot of groundwork right now with CityVet. Another interesting thing is we've opened up 2 clinics this year, and typically we would have a big grand opening event, right, where we bring in the community and introduce our doctors, and that has not been a thing that we've been able to do. And so it's virtual events and introducing them online, and then we really haven't done a lot of traditional media. We've really focused our dollars on digital. I think when you have a smaller budget, you should really focus your money on areas where you can actually make an impact, not spread yourself too thin, right? So just really focusing, and digital consumption is up so much because people are on their phones a lot right now. And so that's really where we've kind of been pushing our money is to digital.
Yeah, I like hearing it, and I wonder if that trend is going to continue. Well, we'll talk about trends in a little while, but moving to digital and getting your most effective CPAs as possible. I think traditional and over the air and all that stuff has a great place in the world once your digital is taken care of, because the CPLs are best there. Kelly, how did we get the message out? Any marketing tactics that were big for you guys this year? Your website full of great videos. So I know you believed in that, and it was a big piece of how you guys position yourselves there in Angola. What else this year did you find yourself pivoting to?
So obviously a really, really weird year to be a healthcare marketer. It's very odd, obviously, to ask people to stay out of your facility, which we found ourselves doing early on, even on the hospital side. And so initially, really, and throughout the pandemic, PR has been a huge focus for us. We obviously hold ourselves to a little bit of a different standard simply because we are the only healthcare option for a lot of people that live in and around our area. So educating them, getting appropriate information out, having consistent supportive messaging from other entities was really important for us. So we comprised a countywide task force that included representative from all of the local schools, a local university, EMS, the local board of health, all kinds of stuff, and even actually local media. We invited them as well. We just wanted to make sure that we had the most organized and supportive response across the board, because we thought that would obviously help us diminish some of the confusion. So PR was huge. We obviously really expedited our expansion of our telehealth services and started marketing those pretty aggressively in really every single way that we could, all the way down to calling patients individually from our offices. And then we've also really capitalized. We've noticed that we had a lot more captive audiences, especially during the shutdown, and we had a lot more increased kind of interaction on our social platforms. So we really beefed up content there as well.
Yeah, I love it. Let's talk more about telehealth. So everybody pivoted quickly. Hey, we want to make sure we can see you as soon as possible. We see with some of our DSOs, our big dental groups, it's still not a huge take rate, even on the initial consult with some of our clients. So what is the take rate as a percentage of first-time visits? Are you guys finding that telehealth is being utilized extensively? Is it going to be a need to have in the future? Amanda, what were you seeing, and what do you think is going to happen with telehealth? Is it still going to be all the rage?
Yeah, I mean, I think that it's one of those things where it's going to become what people expect to have as an offering, but I don't know if people are still going to want to use it. It seems like it needs to be there. But especially in the dental space, like we were starting that at Dental One right before I left, and it's talking about like, well, how is somebody going to treat me? How am I? And really educating a client of what to expect on a telehealth visit. At City Vet, we actually it's very interesting because we use telehealth, but it's in a way where the pet parent is in the parking lot on the phone, and the pet is with the vet. So you still have that like hands-on experience of where they're actually examining but the telemedicine part, it's very different. But I do think that it's going to become a patient expectation. I think as marketers, it's going to be our job to educate them of what that experience is. So we're setting those expectations.
Yeah, absolutely. It's got to be an option, but it may not be the most viable one for a lot of people. I think for PCP, if my kid is sick or I may have something or urgent, I think it makes a lot of sense. But like Blair, for ortho, you tear your ACL, like you need to go in and the MRI can't tell you everything. And so what did you also, as a total percentage of patient?
Very small. Yeah, very small. I think like everybody, right? In March and April, it spiked. I mean, we had very, 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 very small take rate on telemedicine beforehand, and all of a sudden it was everything. The reality is in orthopedics, you can't get an X-ray over your laptop, so you got to come in. And so what we've found is that we've actually altered our offering to now be very specific to the type of visit. So we'll now see you either for something that is post-op. I can show you my knee incision if I can put it on the screen, or I can give you how is this healing? It looks okay. So it can be used for post-op. It can be used for referrals. So we can actually have a referring primary care doctor telemedicine to our doctor with the patient in their room, and then our physician can be seen as a extender to that visit, which would be cool. And then the third option would be for something acute or after hours. So it's more of a peace of mind visit than it's really a treatment visit. It's like my kid got hurt on the soccer field, their knee is swollen up, it's 9:30, nothing's open, but I can see somebody either from my phone or over the screen, and at least just be reassured that it's not something terrible that they have to go to the ER. But that's really where it's nestled out for us. It's 1 to 2%. It's very, very small. Great. Yeah,
so small, but can be useful for the post-care and things like that. I had to go in for some hours waiting for the provider just to check the incision's fine. Yeah. Yes, knee is still weak. I don't work out enough. Like, we got it. I could have done this.
And we know enough now too to know that it's probably going to be okay. If you've had hip replacement surgery and it's been 6 months and you've had no issues, your 6-month checkup, you're fine. You're going to be fine, because if you've had an issue, it's happened before 6 months. So why make that person come in? They can just come in, show us the incision, 7 minutes, they're done. Because 99% of the time, it's 6 months. If you've had no pain and you can walk, you're fine.
I love it.
Yeah.
I love it. I'm going to do a quick hit question. Yes, no, very fast answer. And then we're going to get to one final trends question. All right. Budgets up or down for 21? Kelly, up or down?
Up.
Mark? Yes. Amanda, up or down for next year?
Up.
All right. Love it. Blair?
Up.
Marketing wins. Isn't that the first thing everybody fires when a pandemic? Okay. All right, you guys heard it. Don't back off. And I'm getting a lot of chats in here. A lot of people saying they're going back to direct mail since everyone is home. That's interesting. Infusionsoft and HubSpot seem to be big CRM and marketing automation tools. FYI, lots of good stuff happening in there. All right, let's talk trends because we got 9 minutes and I want to get to a few more audience questions. We're talking about some of the pivots you made this year. Let's assume vaccine somewhat in place 3 to 6 months from now. How are you guys treating that? Are you assuming vaccines coming and we're going back to the things we used to do with traditional direct mail and things? What do you guys, are we seeing anything you're going to do differently next year or a big trend all these great healthcare marketers need to know about? Kelly, what do you see next year?
Well, I think the pandemic's obviously changed healthcare forever. And I don't think we're really clear yet as to what the new normal will look like, across the board. But as it relates to marketing, Cameron, we're really looking to just capitalize on our newfound admiration in our community. We want to now invite those that otherwise wouldn't have considered Cameron to experience us in other areas of care that maybe they wouldn't have previously considered. So we are looking at actually pivoting and doing a full new branding campaign and reintroducing Cameron to our market. We have grown from a critical access just hospital, adding a medical group in the last 4 years with upwards of 38 providers that we brought on board in that time. And so we're ready to take that sophisticated step into more of a Cameron Health kind of system type. So.
Yeah, so not reacting to the pandemic. This would have been the business course anyways. I like that. Not pulling back, not changing. This is the business strategy you had, and maybe it delayed things a little bit, but moving forward and promoting those 38 providers and trying to change perception of how Cameron's known in the local area. I like it. Amanda, what are we looking at for next year? Budgets are up. What are you thinking you're going to invest more in? What should all these great marketers be doing?
Yeah, well, I think what I've always done and what I will continue to do is plan for the year. And then look at the quarter and meet every quarter to say to check in at how we're doing, and then monthly adjust. And so, first quarter is going to look very similar to what we're doing right now. And then once we get to second quarter, if our clients are wanting to come in and we're able to open up all of our lobbies to do those things and have grand openings, then we're going to shift then. I think as, an overall trend for 2021, I think we're going to see a lot more one-to-one connections with, conversations and chatbots and social messaging. And I think that the more that we can do that, the better. That's what people want, is that connection. And I think that, AI-powered solutions are going to really change how we do that. And so, kind of continuing to watch that is something that I will watch in 2021. But right now, I think we'll continue to really focus on digital and our digital presence and what the client journey looks like online.
Interesting. And the AI-powered technology and the conversation pieces are part of the digital equation, right? And so the chatbots, automated or not, they help get questions answered faster. And
we have it on our website, and we really like it. It's really a great way for
automated or handled by someone.
So they are handled by our front desk team.
Really?
Yeah, wow. It's after-hour messages, but we have a chat bot on our website, and so you can make an online appointment. But also the nice thing is you can talk to them about like what's going on to know whether it's urgent or not urgent, and we can kind of assess and have those conversations, and you could book an appointment completely through text.
I love it. I did not know that. Everybody go to citybed.com. Don't mess with Amanda, though. Don't be asking weird questions because you heard it.
I don't get the messages. If you want to book an appointment, though, in DFW, come on down. We'll get you in.
I love that though. Our generation especially, we don't want to call. So if you let us, you can schedule through the chat box. Blair, we've got online scheduling. You rolled it out a year ago. You've got it tied in with EMR, so it's backed up by the actual provider schedules. Are you tracking marketing all the way through? And is that a trend you want all of our great marketers listening to look more in acquisition next year?
Yeah, no, absolutely. So we are lucky. We have it all the way through. So we can see from, the minute they, engage with your ad all the way through booking an appointment. We can track it all the way. And what's been great is we've been able to both do like almost like a multivariate A/B testing, right? What you could do is you could figure out, is it the marketing that's driving them to the option to choose online? And then once they're booking online, is there something in that process that needs iteration? And so sometimes the two meet, sometimes they don't meet, and sometimes they're in isolation. So we learned a thing or two. For a while, we were requiring insurance type. Then we took out an insurance type. Then we were requiring tight age ranges for physicians. Then we went to wider age ranges. Then we separated them by location and we made physicians. So we've learned a lot in terms of making the user experience simpler. So I think our big thing to look at for 21 is, and I'm just going to say, man, I love chat. We're dabbling with chat now. We're piloting it in one of our offices through billing, but we need to be at online chat. We have to be there. We can just solve, one agent having 3 conversations versus one agent having 1 conversation, and we can automate so much of the process. But one of the things we're really leaning into is how do we become easier to use as a business?
Okay.
One of the things that as a consumer I found frustrating as hell during COVID is you want to see if the restaurant you wanted to pick up your food from was open. They never bothered changing their Google My Business page. It still said they were open, and in fact, they were not. Yeah. So you said to me, you've got to be easier to use. Mm-hmm. And I don't think that will end even if we get a vaccine and things go back to normal. Yeah. Shouldn't we still be easier to use? So I think that's going to be our focus and our approach, is being easier to use as a business for consumers and patients.
And marketers, what I heard there, you were ahead of the game with the online scheduling, the EMR integration, and now chat and everything. I mean, no matter how innovative you are, how ahead you are, it never stops for us. I guess it's job security these days with technology becoming a bigger part of our world. But now you need to get into all kinds of new things. Guys, don't stop innovating is what I heard from all 3 of these phenomenal marketers. Thank you all for your questions. We've run out of time. Blair, Amanda, Kelly, would it be okay if they have questions, Blair, if they want to see any of your attribution and of the scheduling, Kelly, the PR plans and how you partner with your B2B liaisons, if they find you on LinkedIn, is that okay? And they send you a message?
Please, that'd be great.
And we get a lot of on-demand downloads for this in the future. So if you get someone in 6 months that asks you, don't be creeped out.
Cool.
That's great. We all have to help each other out.
Yeah, we have to, and it's not just years like this. I mean, we all have to. Healthcare is changing. Healthcare marketing. Healthcare is not changing as quickly, but the marketing side of it changing very fast. We're at the forefront of it, especially you 3. So thank you for joining us. I'm sure everybody had a blast. This was hugely informative. We went off script, and I think it worked really well. Everybody picked up the trends and what you guys did this year to pivot. Happy to hear business is returning a bit back to normal, and let's hope everybody stays happy and safe. So thank you all for joining, okay?
Yeah, it's my pleasure. Thanks for having us.
All right, guys. Thank you, everybody in the audience. If you need anything, personally reach out and I'll email you. You should all be getting the recorded version of this in the next day. If something doesn't happen, feel free to reach out to me. I'll make sure we get it done, okay? All right, guys. Have a good rest of the day.
Thank you.
See you guys.
Thank you.